If you got sick in the Tudor times, the chances are the first thing a doctor would do is not to examine you, but have a look at a wheel of your wee. Tudor medicine is something that may just have been so wild and so wrong it led to the death of a famous monarch. What was a urine wheel? Well, in Tudor times, it was a printed chart and you would pee and your doctor would match your sample against the colour, the clarity and the smell. And then they would have an idea of what illnesses you just might have. Whilst we do think they're kind of wild, let's be honest, have we not all seen that cute wee sheet that they have in the doctors still to this day with all the different colours down? So maybe the doctors were onto something. Drinking wee was something that was done not in Tudor times, but if your pee tasted sweet when your doctor drank it, it was a sign of diabetes. Personally, I think it's just really, really gross. What do you think about where the stars are aligned on the day you turn up at your doctor's sick? Your zodiac sign was felt to really matter for your doctor's treatment. And they had a chart called the Zodiac Man, and he was split into different areas. So Aries governs your head, Pisces governs your feet. I'm a Gemini and that governs heart and lungs. In other words, this is an area I might have a problem with, and so I should guard it well. Well, before your surgeon would treat you, he would check out his Zodiac Man and check out your zodiac sign. And then he would treat you if the stars aligned. No surgeon in his right mind would treat a part of you that was shown on a Zodiac Man if the stars were not aligned. That was considered to be reckless. So if tasting your wee and treating you based on where the stars are aligned weren't crazy enough, let's look at the idea of the four humours. Now, the four humours come from over 1,000 years of medicine before Tudor times. The four humours were your four bodily fluids, and they needed to always be in balance. So it was your blood, your phlegm, your yellow bile, you know, when you're sick and you get all that yellow stuff, and your black bile. Your black bile actually doesn't exist, but four humours were a Greek invention, and they were said to match with how people behave. So depending on which one of your humours was out of balance would depend on what your doctor would recommend for treatment. Spoiler alert, treatments were normally bloodletting related. He believed that if he drained off the excess humour through your blood, that he would create the balance again. And so they would open up a vein using a small blade called the lancet, and they could drain off a whole pint of your blood in one sitting. Now, we are quite smart today, and we know that if you day after day, week after week, take blood out of somebody, not feeding them, not giving them time to heal, they are not going to get any better. And they literally bloodlet people to death. Treatments were even more wild if you had the plague. Tudor times, the beginning of Tudor times, plague was still a problem. And they would recommend tying a dried toad to the neck and wearing it a la pendant. If you were a bedwetter as a child, then you could look forward to eating a roasted field mouse whole. That was what they truly believed, and it isn't an old wives' tale, would cure your bedwetting. Quite a horrible idea. If you were rich, your treatments were a little more special, a little more precious. You could look forward to drinking ground up emeralds or drinkable gold. Neither of which, I'm sure, if you truly ingested them, would do you any good at all. However, doctors made a very lucrative business in these purifying powders. The rich did not get better health care. They just got doctors qualified in quackery to treat them. So who did the poor get? Poor got the local barber. Yes. The reason he has a pole outside his shop with the red and the white is red for blood and white for the bandages. Your local barber would double up as a local doctor. He was able to do your bloodlettings, he was able to do tooth extractions, and he was able to do simple surgeries. There's nothing to say that these actually worked and they didn't kill more people than they cured. So yeah, treatments for the rich were ingestible jewels. Treatments for the poor was your local barber with the same razor he's probably just shaved your throat, cutting other bits of you. Gross. Did your barber need a degree to practice as a doctor? No, all he needed was a trade license. So how did Tudor medicine potentially lead to the death of one of the greatest kings England's ever known, my fellow red-headed pal, Henry VIII? Well, doctors in Tudor times believed that when you got a big cut and it caused what they called laudable pus, which is pus that you could see, you know, the white oozy stuff, that the best treatment for it was to continue opening up the wound all of the time to let the pus continue to come out. The problem with this really great idea is it meant that the cut was constantly getting infected and reinfected. In the case of Henry VIII, this means that he had a cut open on his leg from his late 30s. Around 1536, he has a big fall while he is jousting, and the wound is much more serious. And that means now that this wound is never closed again for the rest of his life. His personal surgeons, and he had 3 of them, who were at that point considered to be the most medically trained men in the whole of England, all had the same idea. They would lance the wound to keep it open, keep the pus coming out, keep dressing it and popping poultices on it. Now, poultices are designed to pull the pus and the sickness and the mess out. And Henry VIII actually even designed his own poultices using things like violets. Henry probably did this because his leg stank. It is recorded in court reports that ambassadors from other countries said his leg could be smelt from 3 rooms away, which is truly gross. The question has been asked before, did these Tudor doctors' treatments kill Henry VIII? Whilst they might not have led to his death exactly, they didn't help him to stay fit and healthy. He became more and more obese. Diabetes developed in him. He's also believed to have had syphilis to go along with all this. Immobile led to the growing into this what we can only call corpulent creature that we see represented in the famous Holbein pictures. And many said, well, he was being made this big to show the power of England. Actually, Holbein probably made him smaller than he truly was, because he was absolutely gross by the time he died. And that manky leg wound definitely didn't help. Personally, I can't imagine having a leg wound open on my leg for over a decade. That is simply grim. So, Tudor medicine, do you think it cured anyone or did it kill them? Let me know in the comments box below. Have a look at the next video. It'll be somewhere up around here. And please give a subscribe. It's been great to hang with you.